Hey guys, I'm going to talk about exercise oncology and a high intensity interval training for cancer survivors. What's the correlation between them? Because I'm getting a lot of questions from trainers, coaches, or the patients itself after cancer treatment, what we should do. So, exercise is a significant component of primary cancer prevention and for improving the health and well being of cancer survivors post the treatment. So, in addition, there is a growing body of evidence that post cancer treatment exercise reduces the risk of reoccurrence and increases the longevity. Accordingly, exercise guidelines that reduce the risk of developing cancer has been established for sure. And exercise guidelines after cancer treatment have primarily been developed over the last 2 decades or so. The goal of exercise programming for cancer survivors is to improve physical fitness, physical functioning, quality of life, cancer-related fatigue through individualized exercise plans or customized exercise plans. So there is emerging evidence in exercise oncology that manipulating the duration and intensity of exercise sessions may be a effective strategy in improving the clinical outcomes of cancer survivors. So, based on the current literature which I have gone through, an effective exercise prescription that most consistently addresses the health related outcomes experienced due to cancer diagnosis and cancer treatment includes moderate intensity aerobic training. And the frequency would be like a 3 days a week for at least 30 minutes per session for 8 to 12 weeks. Now, addition of resistance training, you can add to it to aerobic exercise at least like 2 times per week, or let's say like 3 days a week, depending on your health conditions and your fitness levels. So, using at least two sets of 8 to 15 rep range, approximately at a 60% of your one rep max, appears to have a similar kind of benefits. So, there is emerging evidence that the addition of HIIT may be beneficial for cancer survivors, high intensity interval training. In general, these collective papers, which I have gone through, indicated that HIT was superior to usual care in improving aerobic activity. VO2 peak, what we call, or VO2 max. I'm not going to dig into VO2 max, what it is, and how we calculate that. We'll make a separate video of that. So VO2 peak, but not superior to participating in a moderate intensity aerobic exercise. So from the summary data, frequency of interval training appears to be optimal at about 2 to 3 sessions per week. But this is highly dependent on the initial fitness level. Intensity levels of the HIIT are variable, but generally in agreement with definitions of HIIT is like 80 to 100% of your heart rate max or peak of your heart rate. So, an important note here is that peak heart rate after cancer treatment in an untrained individual is most likely lower than age predicted maximal heart rate or a true maximum heart rate. So this creates a situation whereby the high intensity level for a cancer survivor HIT program may be relatively low compared to a HIT program or training programs for a healthy individual who is not a cancer patient. So most exercise oncology HIIT studies have used treadmill walking or running on a cycle ergometry as a mode of exercise during the training sessions. On an average, individual training sessions in the studies which I have gone through presented range from 45 to 90 minutes up to 90 minutes. So most studies reviewed did not detail which I have gone through about exercise progression. So totality of the data on HIT for cancer survivors is small and generally appears safe for cancer survivors. But making assumptions that HIT is safe for all the cancer survivors is not advised. That would be a bullshit decision if you go through like that. So let me talk about risk and contraindications for exercise training for cancer survivors. So now cancer and cancer treatment creates an enormous emotional, physical, financial burden for most survivors. As a result, survivors nearer to the end of the treatment are most likely deconditioned for sure and emotionally fatigued. So it is recommended that the exercise prescriptionists or trainers working with cancer survivors have a solid understanding of the contraindications to exercise testing and training and be able to recognize the signs and symptoms of changes in the health status of the person they are training. Because after treatment, bad things go up and good things go down. your pulmonary function, your muscle mass, cardiac function, your immune function, your bone health. These all things go down, and what things go up is your body weight, the inflammation, trauma, scarring, lymphedema. If you know what is lymphedema, is a swelling in the peripheral area due to lymph damage node or removal of the node due to cancer treatment. So you need to understand all the things when it comes to training a cancer survivor. What type of cancer is it? Like how long he has gone the treatment? What is his mental challenge and what he can take? So these are all things has to be taken care of when you prescribe anyone after the cancer treatment. Thank you so much.